Question 1. Radiology and dental imaging. Which of the following scenarios demonstrates the correct application of the ALARA as low as reasonably achievable principle in dental radiography? A. The dental assistant positions the X-ray cone as close to the patient's face as possible without a lead apron to minimize scatter radiation. B. A dentist takes multiple retakes of a bituing X-ray due to incorrect positioning without making adjustments to improve accuracy. C. A dental assistant ensures proper collimation, uses a lead apron with a thyroid collar, and limits exposure time while capturing digital radiographs. D. Routinely takes full-mouth X-rays on all patients regardless of their dental history to ensure complete records. Answer. C. A dental assistant ensures proper collimation, uses a lead apron with a thyroid collar, and limits exposure time while capturing digital radiographs. Explanation. The ALARA principle is a key guideline in dental radiography aimed at minimizing radiation exposure to both patients and dental professionals. The correct answer, C, aligns with this principle because it incorporates essential protective measures. Proper collimation reduces excess radiation spread, use of a lead apron with a thyroid collar, which protects sensitive tissues, and limiting exposure time, which reduces unnecessary radiation. Option A is incorrect because while positioning the X-ray cone closer can reduce scatter, not using a lead apron is a violation of safety protocols outlined by the National Council on Radiation Protection and Measurements (SRP). Option B is incorrect because repeated retakes without making necessary adjustments violate ALARA by increasing unnecessary exposure. The correct approach would be to adjust the positioning before taking another X-ray. Option D is incorrect because taking full-mouth X-rays on all patients regardless of necessity contradicts the ALARA and the American Dental Association (ADA) guidelines, which recommend radiographs based on individual patient needs. Question 2. Emergency procedures and first aid scenario-based. Dr. Thompson is performing a routine extraction on a patient when the patient suddenly becomes unresponsive and stops breathing. The dental assistant, Maria, quickly checks for a pulse but does not feel one. What should Maria do next? A. Begin chest compressions at a rate of 100-120 compressions per minute while calling for emergency assistance. B. Attempt to wake the patient by shaking their shoulders and splashing cold water on their face before calling for help. C. Leave the room immediately to find the doctor, then return to assess the patient's condition. D. Administer an EpiPen, assuming the patient is having an anaphylactic reaction, and wait for response before proceeding. Answer. A. Begin chest compressions at a rate of 100-120 compressions per minute while calling for emergency assistance. Explanation. The correct response is to initiate cardiopulmonary resuscitation (CPR) immediately when a patient is unresponsive and has no pulse. The American Heart Association (AHA) and OSHA guidelines emphasize high-quality chest compressions at a rate of 100-120 compressions per minute to maintain circulation. Simultaneously, emergency services 911 should be contacted. Option B is incorrect because shaking the patient and using cold water are ineffective and delay critical life-saving measures. Unresponsiveness without breathing or a pulse indicates cardiac arrest, requiring immediate CPR. Option C is incorrect because leaving the room wastes valuable time. The dental assistant should stay with the patient before CPR and instruct someone else to retrieve additional medical support. Option D is incorrect because administering an EpiPen without signs of an allergic reaction, e.g. difficulty breathing, swelling, rash is inappropriate. CPR is the correct response for a patient with no pulse. Question 3. Orthodontics assistants. Which of the following statements correctly describes the role of a registered dental assistant (RDA) in orthodontic wire placement and adjustments under most state regulations? A. An RDA can independently place and adjust orthodontic arch wires without direct supervision from the orthodontist. B. An RDA can assist in placing arch wires and securing them with ligatures but cannot independently adjust or modify the wires. C. An RDA is not permitted to handle orthodontic arch wires in any capacity and must only observe during orthodontic procedures. D. An RDA can perform orthodontic wire placements and adjustments as long as they have completed a basic training course. Answer. B. An RDA can assist in placing arch wires and securing them with ligatures but cannot independently adjust or modify the wires. Explanation. Under most state regulations, A registered dental assistant, or DA, can assist in placing arch wires, securing ligatures, and performing limited adjustments, but cannot independently modify or bend the wires without supervision from the orthodontist. The Dental Practice Act in many specifies that RDAS must operate within a delegated scope of practice, ensuring that complex orthodontic adjustments remain the responsibility of a licensed dentist or orthodontist. Option A is incorrect because RDAS cannot independently place or adjust orthodontic wires without supervision. Option C is incorrect because RDAS are allowed to assist with orthodontic appliances, including securing wires and bands. Option D is incorrect because completing a training course does not grant independent authority for full orthodontic wire placements and adjustments. Direct supervision is still required. Question 4. Dental radiography and radiation safety. A new dental assistant, Alex, is positioning a patient for a full mouth series of radiographs. While setting up the X-ray tube head, Alex notices that the patient is having difficulty staying still due to a medical condition. To ensure diagnostic quality images, Alex considers using a shorter exposure time and a higher KVP setting. However, Alex is unsure how this adjustment will image quality and radiation dose to the patient. Which of the following statements best describes the effects of these adjustments? A. Increasing the KVP will result in a lower contrast image, but it will allow for a reduced exposure time, ultimately lowering radiation dose. B. Increasing the KVP will produce a higher contrast image, making caries detection easier, but will increase patient radiation exposure. C. Reducing the exposure time will result in a higher contrast image and decrease patient movement artifacts without affecting overall radiation dose. D. Lowering the KVP and increasing exposure time will enhance image sharpness while maintaining ALARA principles. Answer A. Increasing the KVP will result in a lower contrast image, but it will allow for a reduced exposure time, ultimately lowering radiation dose. Explanation: increasing the kilovoltage peak KVP leads to a reduction in image contrast by producing a wider range of gray tones. However, a higher KVP setting also increases the penetrating power of X-rays, meaning less exposure time is required to achieve an adequate image. By reducing exposure time, patient movement artifacts are minimized and overall radiation doses decreased, following the ALARA as low as reasonably achievable. Principal incorrect answers. B. Higher KVP actually reduces contrast by creating more shades of gray rather than increasing it. C. Reducing exposure time decreases motion blur but does not directly improve contrast. D. Lowering KVP requires a higher time to maintain image quality, which increases radiation dose. Question 5. Sterilization and infection control. Scenario-based. Dr. Patel's dental clinic has high patient volume and the dental assistants are responsible for processing and sterilizing instruments. A newly hired assistant observes that the team is sometimes skipping the ultrasonic cleaner step and placing instruments directly into the autoclave. Additionally, she notices that the sterilization logs are not consistently updated. Raises her concerns to senior assistant. She is told that as long as the autoclave runs, the instruments should be sterile. Well, what should Mia do in this situation? A. Follow the lead of the senior assistant, as the autoclave is the most critical step in sterilization. B. Insist that all instruments go through proper cleaning before sterilization and report the issue to the office manager if necessary. C. Skip the ultrasonic cleaning but increase the autoclave cycle time to ensure sterility. D. Document the missing sterilization steps in her personal notes but take no further action. Answer: B. Insist that all instruments go through proper cleaning before sterilization and report the issue to the office manager if necessary. Explanation: proper sterilization in dental settings follows the Centers for Disease Control and Prevention (CDC) and Occupational Safety and Health Administration (OSHA) guidelines. Instruments must first be pre-cleaned, manual scrubbing or ultrasonic cleaning before being autoclaved. Skipping this step leaves bioburden, blood, and tissue debris on instruments, which can prevent effective sterilization. Additionally, sterilization logs must be updated consistently as part of quality control. Incorrect answers: A. Following improper procedures compromises patient safety and violates infection control regulations. Increasing autoclave time does not remove debris effectively. D. Keeping personal notes without reporting the issue fails to address the non-compliance. Question 6. Endodontic procedures and pain management. A patient arrives at the dental office complaining of persistent pain in a lower molar. The dentist performs a pulp vitality test using an electric pulp tester and finds that the tooth does not respond. The patient also reports swelling near the affected tooth. Based on these findings, the dentist diagnoses the patient with pulpal necrosis and recommends root canal therapy, which following best explains why the electric pulp tester ECT did not produce a response in this case. The tooth nerve tissue is non-functional, meaning it can no longer transmit electrical impulses. B. The ECT is only used for detecting reversible pulpitis and cannot assess necrotic teeth. C. The patient's swelling interfered with nerve conduction, making the test invalid. D. The probe placement was likely incorrect, leading to false negative result. Answer A. The tooth nerve tissue is non-functional, meaning it can no longer transmit electrical impulses. Explanation: when a tooth pulp becomes necrotic, the nerve tissue inside is dead and no longer capable of transmitting electrical signals, resulting in no response during an electric pulp test. The lack of response, combined with clinical symptoms such as swelling, indicates irreversible pulp damage, requiring root canal treatment. Incorrect answers. B. The ECT is capable of detecting necrotic teeth by confirming the absence of response. C. Swelling does not affect nerve conduction inside the tooth. D. While incorrect probe placement can lead to errors, the presence of swelling and pain strongly supports pulpal necrosis. Question 7. Orthodontics and appliance adjustments. A 14-year-old patient undergoing orthodontic treatment with traditional braces complains of discomfort and difficulty flossing. The dentist recommends using an interproximal brush and a floss threader to aid with oral hygiene. However, the patient is unsure why these tools are necessary. Which of the following best explains why orthodontic patients require specialized hygiene tools? A. Fixed orthodontic appliances increase plaque accumulation, which can lead to decalcification and gingivitis if not properly cleaned. B. Traditional floss is more effective than interproximal brushes for cleaning around brackets and wires. C. Once braces are placed, oral hygiene habits have no significant impact on the outcome of treatment. D. Braces protect teeth from cavities, so additional oral hygiene tools are unnecessary. Answer A. Fixed orthodontic appliances increase plaque accumulation, which can lead to decalcification and gingivitis if not properly cleaned. Explanation: braces create numerous retention areas where plaque and food particles can accumulate, increasing the risk of decalcification, white spot lesions, gingivitis, and caries. Using specialized tools like interproximal brushes and floss threaders ensures proper plaque removal. Incorrect answers. B. Traditional floss is difficult to use with braces without a floss threader. C. Poor oral hygiene during orthodontic treatment can result in significant complications, including periodontal disease and cavities. D. Braces do not protect against cavities. They require additional care. Question 8. Dental anatomy and tooth identification. Scenario-based. A patient arrives at the dental office complaining of sensitivity in a lower back tooth when drinking cold beverages. During the examination, the dentist asks you to identify the affected tooth using the universal numbering system. The tooth is located in the lower right quadrant and is the first molar. Which of the following correctly identifies the affected tooth using the numbering system? A. Tooth number 19, B. Tooth number 30, C. Tooth number 14, D. Tooth number 3. Answer B. Tooth number 30. Explanation: the universal numbering system assigns numbers 1, 3, 2 to permanent teeth. The first molars are identified as tooth number 3 upper right, number 14 upper left, number 19 lower left, and number 30 low right. Since the affected tooth is the low right first molar, it corresponds to tooth number 30. Incorrect answers: A. Tooth number 19 is the lower left first molar. C. Tooth number 14 is the upper left first molar. D. Tooth number 3 is the upper right first molar. Question 9. Dental materials and restorations. During a composite filling procedure, the dentist instructs you to assist in placing the etchant, bonding agent, and composite resin in the proper sequence. However, you notice that the dentist did not dry the tooth completely before applying the bonding agent. How might excess moisture on the tooth surface affect the success of the restoration? A. The bonding agent may not adhere properly, leading to restoration failure. B. Excess moisture strengthens the bond between the enamel and composite resin. C. Moisture contamination does not affect the final restoration. D. The etchant will compensate for any moisture, ensuring proper bonding. Answer A. The bonding agent may not adhere properly, leading to restoration failure. Explanation: for composite resin bonding, the tooth surface must be dry but not desiccated. Too much moisture prevents the bonding agent from adhering properly, leading to microleakage, post-operative sensitivity, or early failure of the restoration. Incorrect answers. B. Moisture weakens rather than strengthens bonding. C. Contamination with saliva or moist. Affects adhesion. D. Etchant improves bonding but cannot compensate for excess moisture. Question 10. Medical emergencies in dentistry. Scenario-based. A patient with a history of asthma begins experiencing shortness of breath during a routine cleaning. The patient appears panicked and their breathing becomes rapid and wheezy. You immediately notify the dentist. What is the most appropriate next step? A. Have the patient lie flat and apply an ice pack to their chest. B. Instruct the patient to breathe into a paper bag to slow their breathing. C. Administer the patient's bronchodilator, rescue inhaler, and monitor symptoms. D. Give the patient water and encourage deep breathing through their nose. Answer C. Administer the patient's bronchodilator, rescue inhaler, and monitor symptoms. Explanation. A patient having an asthma attack should immediately use their rescue inhaler, e.g. albuterol, which helps relax the airways. If symptoms persist, emergency medical services EMS should be called. Incorrect answers. A. Lying flat may worsen breathing difficulty. B. A paper bag is used for hyperventilation, not asthma. D. Water and deep breathing do not resolve airway constriction. Question 11. Dental charting and documentation. Scenario-based. You are assisting the dentist in a new patient examination. The dentist dictates that the patient has a Cleome and 2 Carious lesion on the mesial surface of tooth number 5. Which of the following correctly describes this lesion? A. Decay is affecting the occlusal surface of a molar. B. Decay is on the mesial surface of a premolar between teeth. C. The lesion is limited to the facial buccal surface of an anterior tooth. D. The lesion is located on the lingual side of a molar. Answer B. Decays on the mesial surface of a premolar between teeth. Explanation. A cleomentuion involves decay between posterior teeth, premolars or molars. The mesial surface refers to the side of the tooth that faces the midline. Since tooth number 5 is a premolar, the correct answer is B. Question 12. Dental radiography and errors after processing a by-2 in radiograph. You notice overlapping contacts on the image, making it difficult to detect interproximal decay. What likely caused this error? A. Incorrect horizontal angulation. B. Excessive exposure time. C. Incorrect vertical angulation. D. Patient movement during exposure. Answer A. Incorrect horizontal angulation. Explanation. If the X-ray beam is not perpendicular to the teeth, it results in overlapping contacts, obscuring caries detection. Incorrect answers. B. Excessive exposure leads to dark images. C. Incorrect vertical angulation causes elongation or foreshortening. D. Movement results in a blurry image. Question 13. Dental charting and treatment planning. Scenario-based. A 55-year-old patient visits the dental office for a routine checkup. The dentist identifies 2 carious lesions on the occlusal surfaces of tooth number 3 and tooth number 14. The dentist recommends amalgam restorations due to the patient's heavy bite. Which dental charting notation correctly documents these findings using the universal numbering system? A. Tooth 3, O. Tooth 14, O. B. Tooth 3, do Tooth 14, Mo. C. Tooth 3, mod. Tooth 14, do D. Tooth 3, B. Tooth 14. Correct answer A. Tooth 3. O. Tooth 14. O. Explanation. Occlusal O caries refer to decay on the chewing surface of posterior teeth, molars and premolars. Since the decay is only on the occlusal surfaces of tooth number 3 upper right first molar and tooth number 14 upper left first molar, the correct notation is O. Occlusal for both teeth. Incorrect answers. B. Do and Mo indicate decay extending to the mesial or distal surfaces, which is incorrect. C. Mod indicates decay affecting the mesial, occlusal, and distal surfaces, which is not the case here. D. Beat, buccal, and lingual do not describe the occlusal decay. Question 14. Dental materials and impressions. Scenario-based. A patient requires a crown for tooth number 19 and the dentist asks you to prepare for an alginate impression. However, after removing the impression from the patient's mouth, you notice that it has distortion and voids in multiple areas. What is the most likely cause of this error? A. The alginate material was removed too slowly, causing stretching. B. The impression tray was too small, leading to improper seating. C. Too much water was added to the alginate mixture, weakening the material. D. The patient moved excessively, distorting the impression. Answer: A. The alginate material was removed too slowly, causing stretching. Explanation: alginate should be removed in one swift motion to avoid distortion and stretching. Removing it too slowly causes permanent deformation. Incorrect answers: B. A small tray may cause improper seating, but it would not cause stretching. C. Too much water affects the setting time, but does not cause distortion. D. Patient movement could create an issue, but not one described in the scenario. Question 15. Radiography and safety. Scenario-based. While assisting with a full-mouth series of radiographs, you notice that the patient's thyroid collar is missing, but the dentist is in a hurry to complete the procedure. What is the best course of action? A. Proceed with the X-rays since the thyroid collar is optional. B. Inform the dentist and ensure the patient wears a lead apron with a thyroid collar. C. Ask the patient if they want the thyroid collar before proceeding. D. Take the radiographs but increase the distance between the X-ray machine and the patient. Answer: B. Inform the dentist and ensure the patient wears a lead apron with a thyroid collar. Explanation: thyroid collars are especially important for children and pregnant patients to protect against radiation exposure. Always prioritize patient safety and follow radiation protection guidelines. Incorrect answers: A. Thyroid collars are not optional and should be worn whenever possible. C. Radiation protection is not a patient preference, it is a legal safety requirement. D. Increasing the distance does not compensate for missing shielding. Question 16. Periodontal disease and treatment. Scenario-based. A patient with chronic periodontitis returns for a follow-up appointment after undergoing scaling and root planing (SRP). However, they complain of continued gum bleeding and sensitivity. The dentist recommends additional periodontal therapy. Which of the following is the best next step? A. Perform a gingivectomy to remove infected gum tissue. B. Recommend improved oral hygiene and schedule periodontal maintenance. C. Extract the affected teeth to prevent further bone loss. D. Apply a desensitizing agent to reduce discomfort. Answer: B. Recommend improved oral hygiene and schedule periodontal maintenance. Explanation: scaling and root planing (SRP) is the first step in treating periodontitis, but continued maintenance, such as periodontal cleanings every 3-4 months, is required. Patients must improve their oral hygiene routine to prevent further disease progression. Incorrect answers: A. A gingivectomy is not the first step unless excess gum prevents cleaning. C. Extraction is only considered if the teeth are severely compromised. D. The desensitizing agent helps with discomfort but does not treat periodontal disease. Question 17. Medical emergencies. Scenario-based. During a dental procedure, a patient begins exhibiting signs of hypoglycemia, low blood sugar, including confusion, sweating, and shakiness. The patient is diabetic but did not eat before the appointment. What is the most appropriate immediate action? A. Give the patient a cup of water and encourage deep breathing. B. Administer glucose tablets or juice to raise blood sugar. C. Call 911 immediately and wait for emergency personnel. D. Lay the patient flat and monitor their blood pressure. Answer: B. Administer glucose tablets or juice to raise blood sugar. Explanation: hypoglycemia can be quickly reversed by giving a fast-acting sugar source, e.g. juice, glucose tablets, or candy. If the patient loses consciousness, EMS should be called immediately. Incorrect answers: A. Water does not contain sugar, so it will not help. C. Calling 911 is necessary only if the patient does not respond to glucose. D. Lay patient flat is not the primary action for hypoglycemia. Question 18. Prosthodontics and denture care. Scenario-based. A patient with new full dentures returns complaining that they feel loose and uncomfortable and they have difficulty chewing. What is the best course of action? A. Apply more denture adhesive and ask the patient to wait a few weeks. B. Adjust the denture fit and check for sore spots. C. Recommend that the patient stops wearing the dentures permanently. D. Instruct the patient to chew only soft foods for the rest of their life. Answer: B. Adjust the denture fit and check for sore spots. Explanation: new dentures often require adjustments to improve fit and comfort. The dentist should check for pressure points and adjust them as needed. Incorrect answers: A. Adhesive does not fix poor fit. C. Stopping denture use is not a solution. D. Soft foods may help temporarily, but the goal is to restore normal function. Question 19. Sterilization and infection control. Scenario-based. During instrument processing, you notice that a set of dental instruments has visible debris after ultrasonic cleaning. The dentist is expecting these instruments for the next procedure in 10 minutes. What should you do next? A. Wipe off the debris and proceed with sterilization. B. Reprocess the instruments through ultrasonic cleaning before sterilization. C. Place the instruments in the sterilizer as they are, since heat will kill bacteria. D. Use a disinfectant wipe on the instruments before placing them in the autoclave. Answer. B. Reprocess the instruments through ultrasonic cleaning before sterilization. Explanation. Instruments must be visibly cleaned before sterilization. Debris can prevent effective sterilization and harbor bacteria. Incorrect answers. A. Wiping alone is insufficient for proper cleaning. C. Sterilization does not remove debris, only kills microorganisms. D. Disinfecting wipes are not a substitute for proper sterilization. Question 20. Radiography and safety. Scenario-based. While taking a panoramic X-ray, you notice that the image appears blurry and elongated. The patient is uncomfortable and keeps moving slightly during the exposure. What is the most likely cause of the poor image quality? A. The patient was positioned too far forward in the focal trough. B. The patient was positioned too far backward in the focal trough. C. The patient moved during exposure. D. The X-ray tube head was not properly aligned. Answer. C. The patient moved during exposure. Explanation. Any movement during exposure distorts the image. Patients should be instructed to remain completely still to ensure a clear image. Incorrect answers. A. Too far forward causes narrowing, not elongation. B. Too far back causes widening, not elongation. D. Tube head misalignment causes asymmetry, not blurring. Question 21. Dental materials. Scenario-based. A patient with a deep cavity on tooth number 30 is scheduled for a composite filling. The dentist asks you to prepare the materials, but you notice that the composite resin is cold from storage. How might this affect the procedure? A. Cold composite resin will cure faster, reducing working time. B. Cold composite resin will become too hard to place in the cavity. C. Cold composite resin will be harder to manipulate and may lead to air bubbles. D. Cold composite resin will bond better to the tooth structure. Answer. C. Cold composite resin will be harder to manipulate and may lead to air bubbles. Explanation. Cold composite resin becomes stiffer, making it harder to place and more likely to trap air bubbles, leading to weakness in the restoration. Incorrect answers. A. Curing speed depends on the light source, not temperature. B. Cold composite does not become too hard, but it is harder to handle. D. Temperature does not improve bonding. Etching and bonding agents do. Question 22. Medical emergencies. Scenario-based. A patient undergoing a long dental procedure begins to feel lightheaded and dizzy while lying in the chair. They appear pale and sweaty. What should you do first? A. Recline the chair and elevate the patient's legs. B. Give the patient water to drink. C. Encourage the patient to take deep breaths and remain seated. D. Call 911 immediately. Answer. A. Recline the chair and elevate the patient's legs. Explanation. The patient is likely experiencing syncope, fainting, due to low blood pressure. Reclining the chair and elevating the legs helps to increase blood flow to the brain. Incorrect answers. B. Water will not immediately help if the cause is blood flow related. C. Sitting upright can worsen the condition. D. Calling 911 is unnecessary unless the patient does not recover. Question 23. Ethics and professionalism. Scenario-based. A new dental assistant accidentally discards her patient's impression before it was sent to the dental lab. The assistant is afraid of getting in trouble and considers not telling the dentist. What is the ethical course of action? A. Remake the impression and say nothing. B. Inform the dentist immediately and offer to remake the impression. C. Wait until the patient returns to take another impression. D. Blame another staff member to avoid responsibility. Answer. B. Inform the dentist immediately and offer to remake the impression. Explanation. Honesty and accountability are essential in professional ethics. The dentist must be informed as soon as possible to avoid delays in patient care. Incorrect answers. A. Hiding mistakes can lead to bigger issues later. C. Waiting delays patient treatment unnecessarily. D. Blaming others is unethical and unprofessional. Question 24. Restorative dentistry. Scenario-based. During a composite restoration on a premolar, the dentist instructs you to light cure the composite material for 20 seconds per increment. However, after curing, the restoration appears soft and sticky. What is the most likely cause? A. The composite was too warm before curing. B. The curing light intensity was too low or the light was not properly positioned. C. The composite was overcured, making it unstable. D. The etching process was done incorrectly. Answer. B. The curing light intensity was too low or the light was not properly positioned. Explanation. If the curing light is weak or not directly aimed at the composite, the material will not fully polymerize, leading to a soft and sticky restoration. Incorrect answers. A. Temperature does not affect curing. C. Overcured composite does not become soft. D. Etching affects bonding, not curing. Question 25. Dental charting. Scenario-based. A patient with severe bruxism presents with wear on the incisal edges of all anterior teeth and flattened occlusal surfaces at the molars. Which notation best describes these findings in the dental chart? A. Incisal wear on teeth number 6, 1, 1. Occlusal wear on teeth number 3, 14, 19, and 30. B. Attrition noted on all posterior teeth only. C. Erosion noted on all anterior teeth only. D. Abrasion noted on teeth number 2, 3, 14, 15. Answer. A. Incisal wear on teeth number 6, 1, 1. Occlusal wear on teeth number 3, 14, 19, and 30. Explanation. Bruxism teeth grinding leads to attrition, causing incisal wear on anterior teeth and occlusal wear on molars. Incorrect answers. B. Attrition affects both anterior and posterior teeth, not just posterior. C. Erosion is caused by acids, not bruxism. D. Abrasion is caused by external factors. E. Aggressive brushing. Question 26. Medical emergencies. Scenario-based. A patient with a history of asthma is in the dental chair for a routine cleaning. Suddenly they begin to have difficulty breathing, wheezing, and appear anxious. They signal that they cannot catch their breath. What should you do first? A. Place the patient in a supine position and administer oxygen. B. Encourage the patient to take deep breaths and continue treatment. C. Assist the patient in using their prescribed inhaler and monitor their breathing. D. Call 911 immediately without attempting any interventions. Answer. C. Assist the patient in using their prescribed inhaler and monitor their breathing. Explanation. This is likely an asthma attack and the patient needs their inhaler to relieve airway constriction. Monitoring their breathing ensures they are responding to treatment. Incorrect answers. A. Supine positioning may worsen breathing difficulties. B. Continuing treatment is unsafe until breathing stabilizes. D. Calling 911 immediately is only necessary if the inhaler does not work. Question 27. Infection control. Scenario-based. While setting up for a root canal procedure, you accidentally touch the sterile endodontic file with your ungloved hand. What is the best course of action? A. Wipe the file with an alcohol pad and continue using it. B. Place the contaminated file in a disinfectant solution for 10 minutes. C. Discard the contaminated file and obtain a new sterile one. D. Rinse the file with water and proceed with the procedure. Answer. C. Discard the contaminated file and obtain a new sterile one. Explanation. Any sterile instrument that becomes contaminated must be replaced to prevent cross-contamination. Alcohol wipes or disinfectant solutions are not substitutes for proper sterilization. Incorrect answers. A. Alcohol does not sterilize the instrument. B. Disinfectant solution is insufficient for an instrument entering the root canal. D. Water rinsing does not remove pathogens. Question 20. Radiography and safety. Scenario base. While taking a bituing X-ray, the patient suddenly says they are experiencing sharp pain in their mouth. Upon inspection, you see the edge of the film pressing against the soft tissue near the floor of the mouth. How can you adjust to improve patient comfort? A. Ask the patient to tolerate the discomfort and complete the exposure. B. Use a smaller sensor or adjust the placement to avoid soft tissue irritation. C. Reduce the exposure time and take the image quickly. D. Have the patient bite down harder to hold the sensor in place. Answer. B. Use a smaller sensor or adjust the placement to avoid soft tissue irritation. Explanation. Proper sensor positioning minimizes discomfort and ensures a clear image. Using a smaller sensor or repositioning it helps prevent soft tissue trauma. Incorrect answers. A. Forcing the patient to endure pain is unethical and unnecessary. C. Reducing exposure time does not solve the positioning issue. D. Biting harder increases discomfort. Question 29. Restorative dentistry. Scenario-based. A patient has an amalgam filling placed on a molar. Shortly after the procedure, they complain of a sharp electrical-like pain when biting on metal objects, such as a fork. What is the most likely cause? A. The filling is too high, causing occlusal trauma. B. The patient is experiencing galvanic shock due to metal contact. C. The filling was not fully cured, leading to post-operative sensitivity. D. The patient has an undiagnosed cavity in another tooth. Answer B. The patient is experiencing galvanic shock due to metal contact. Explanation: galvanic shock occurs when two different metals, amalgam and fork, create an electric current in the moist oral environment. This can cause a brief but sharp shock when biting on metal. Incorrect answers: A. A high filling causes pressure pain, not an electrical sensation. C. Amalgam does not require curing like composite resin. D. A separate cavity with this specific symptom. Question 30. Ethics and legal responsibilities. Scenario-based. A dentist instructs you to take radiographs on a pregnant patient despite the patient's concerns about radiation exposure. The patient explicitly says, I don't want x-rays because I'm pregnant. What should you do? A. Take the x-rays since the dentist requested them. B. Explain the safety measures and obtain written consent before proceeding. C. Ignore the patient's request and reassure them that x-rays are safe. D. Tell the patient they must get the x-rays or reschedule their appointment. Answer: B. Explain the safety measures and obtain written consent before proceeding. Explanation: patients have the right to refuse treatment, including x-rays. If x-rays are necessary, informed consent is required after explaining protective measures. G. Lead apron minimal exposure. Incorrect answers: 8. Following the dentist's order without patient consent violates ethical guidelines. C. Ignoring the patient's concerns disregards autonomy. D. Forcing x-rays is unethical and unnecessary unless medically urgent.